Hello and welcome to this first of what we hope to be and plan to be a series of in-person and online roundtable discussions about things that we don't seem to talk about. We're calling this series the Unspeakable Bits from a Life with MS. I'm Trevis L Gleason and I'll be your host. We thank MS Ireland for their support and for giving us this platform to delve into the topics that once and I suppose often still are considered too taboo, but are real and important parts of getting over, under, around, and through the challenges of living with this disease. Today's topic is about as important and as ignored as we're going to find in the broader society, let alone in the disability community. Today, we're going to talk about sex. Now, while we plan to be respectful and professional as we broach this topic, it is important to understand that Ireland and I suppose much of the world have a complicated historical relationship with sex between the church and the state and society telling us how evil our sexual selves are. It's no wonder that we do. We have no intention to offend, but we will be attacking this topic head on. Sex is a natural, healthy, and well, it's fun. Be it with the opposite sex partner or a same-sex partner or with no partner at all. Sex is an important part of the facets of the human condition. So we're going to speak the unspeakable. Joining me on our virtual roundtable today are two experts in the field of MS, but MS sort of beyond just neurology. Professor Claire Yang, MD, is a consulting urologist specializing in issues connected with the neurological diseases and injuries. She is a professor of urology and an adjunct professor of neurology at the University of Washington. Welcome to you, Professor Yang.
Thank you for having me.
Absolutely a pleasure. And Dr. Michelle Toshima, PhD, is a clinical psychologist specializing in rehabilitation therapy at the MS Center of the Swedish Neurological Institute. Dr. Toshima, you are very welcomed as well.
Thank you very much, Travis. Happy to be here.
Now, it's, I suppose, as a note of disclosure, it's relevant to state that I have been in great good fortune to have been under the professional care of both of our guests in the past. Lucky is the man who has doctors like the two of these wonderful ladies on his medical team. I'm now happy to call them friends and colleagues in our greater fight for a better life with MS. So with that, on to the subject at hand. I suppose this is a question for both of you, and we'll start with the low-hanging fruit. How is it that MS, the disease, can affect our sex lives? Professor Yang, we'll start with you.
Well, MS is a disease that attacks the nerves and the nervous system. And because the sexual response, the things that happen when we become sexually aroused, when we engage in sexual activity, because those activities and responses are very much dependent on nerves and the nervous system, the diseases that attack the nervous system invariably affect the sexual response. And so at the very core of the disease, nerve damage is what affects sexual responsivity, affects our sensations, affects how we respond, how we can, act on what we're feeling. As well, medications can affect the sexual response. So medications that will help mitigate symptoms of MS can also affect the sexual response. And then finally, the other effects of MS that aren't directly affecting the sexual response, but affect other parts of the body and affect other functions of the body can indirectly affect the sexual response as well.
And we will get to some of that, and as a way of sort of giving you permission here, I can say that the nerve damage part, I was a subject in one of your research projects that attached needles and electrodes to places that we're talking about here, and you were able to measure specific nerve transmission damage between the brain and the sexual organs, et cetera. So this is something that is that can be scientifically proven. It's not just I don't seem to feel in the mood. There is real damage there.
Correct.
Yeah, and so then they say that our largest sexual organ is our brain. So Dr. Toshima, how is it that the mind, so not just the brain, not that just the wiring, but the mental stuff, how can that take a hit from the disease when it comes to sex and then our sexual relations and relationships?
Very good question. So as Dr. Yang was referring to, she was talking about some of the direct effects of MS on sex, including some of the secondary effects, which include MS symptoms on sex, like fatigue, pain, spasticity, cognitive problems, on and on. And so when you are dealing with all of these issues, invariably it can affect your mood. It can affect how you feel about yourself, your self-esteem. It can affect your anxiety and issues around performance and are things going to work or how are they going to work. So when you couple all of that brain stuff in with sex, it's like it really can cause people to turn away, to be afraid, to not want to explore or engage in their sexual activity or arousal or even explore these concepts and what's happening with them. So I think, again, the way that the brain can get involved, the way that the psychology can get involved with MS and sex is directly mood-related issues, fatigue, decreased interest, performance, self-esteem issues, body image issues, anxiety, all of those things. So what I encourage patients to do is think about what's really holding me up here. And am I willing to look at some of the underlying issues that may be getting in the way of my ability to not only explore and engage in sex, but enjoy it?
And again, it's fun. It's funny. If we forget that part, when it can get difficult and messy, both emotionally and physically, we're halfway down a bad where and there. This might again be for both of you. As with so many aspects of MS and MS symptoms specifically, it can be difficult to discern between what we might call typical age-related sexual issues and MS-induced ones. So how might one be able to tell the difference between I'm getting older and this is typical, I hate to use the word normal because I don't think any of us with MS are normal, though we would really like to be normal in our abnormalities. How can we tell the difference between what might be typical and what might be as in age-related and what might be MS related? I know we have that question for ourselves and our neurologists all the time when it comes to aging and MS symptoms in other aspects. So we'll start with you, Dr. Toshima, as to the sexual versus age-related difficulties we might have with MS.
So I'm going to pop your bubble here, and I'm going to say, from my perspective, it doesn't really matter, right? Okay. I feel like people sometimes focus too much on the why and not the what. And so I always encourage patients, at least from my point of view and perspective, I'd say it doesn't really matter if it's aging. It doesn't really matter if it's MS. If it's bothering you and there's a symptom or a barrier, an obstacle, let's address that. Let's figure out what we do about it. And I think, again, even when I'm dealing with MS patients around other symptoms like fatigue or depression, is it because of the MS or is it a reaction to coping with the MS? I always, again, try and get people to shift from the why to the what. So I don't know if that answers your question, Trevis, but I would sort of say it doesn't really matter. If there's a problem, let's address the problem.
When it comes to the psyche, I suppose that makes perfect sense. It doesn't matter. Doesn't matter why your toe hurts, whether you stubbed it or you dropped something on it, your toe hurts. Perhaps when it comes then to possible mitigations via medication, et cetera, we might be looking at the physical parts of it differently. So Professor Yang, how might we, or should we even be concerned whether it's normal aging or if it's MS when it comes to sexual symptoms?
Well, I agree completely with Dr. Toshima, and part of the distress of having sexual dysfunction is from not knowing why it's happening. And it's natural for people to want to attribute a specific cause. Is this due to getting older? Is this due to MS? Is this due to something else? But the reality is that it doesn't really matter. And for sexual dysfunction, the treatments don't really require attribution, if you will. We don't need to sort out why things are happening. The treatment is geared toward helping the response along, no matter the cause.
And then there's, of course, there's the secondary there. It's like, all right, so I can take a medication to obtain and maintain an erection, but if other MS symptoms of limb weakness or spasticity are involved, then there can be something else that we're looking at there. But the mechanical sexual part, that can be handled, and it doesn't really matter then whether it is MS or it's aging, etc. But we also know that we're all carrying a bunch of luggage there beyond just the sexual organs, I guess, as it were. And that's something that I suppose that there would be physical therapies, there would be pharmaceutical therapies, etc., that might be able to help with those aspects, even though they're peripherally sexual, they're not necessarily sexual. Is that correct? Okay. So sticking with you, Professor, sex is obviously part of the reproductive process as well as the pleasurable part of life. So issues such as MS disease-modifying drugs and contraception, or MS disease-modifying drugs and conception. When or if does someone become pregnant, or do they try to become pregnant with MS? So much of this comes into play. Are there any MS-specific fertility issues? And I know you're urology, not OBGYN here, but that people should consider that part of their sex lives, that wedge of the sex pie.
I don't believe there is any, there, we call them in medicine contraindications, meaning you shouldn't do this when, or you shouldn't do this as a result of your MS to avoid conception. But I would definitely encourage people who are interested in becoming biological parents, and if they are on MS related medications, to ask their MS providers if there are any special considerations. So is that your question?
Yeah, that's good. And that actually leads me to the kind of a next question for Dr. Toshima, because we're talking pretty freely here about sex, but it can be difficult from talking about it with a medical team to our long-term partners. And I suppose especially we've heard from people in the MS community that talking with their casual sexual partners, if they're not in a long-term committed relationship, but we're not to use the term one night stand, but you're going and you're meeting up with someone and you're swiping whichever direction you swipe. It's a lot to unpack, but are there a few bullet points that we can use, whether it's talking to our medical professionals or talking to our partners? I mean, I remember, and I suppose this is generational as well. I used to lead a men's self-help group with MS, and there was a gentleman that was well into his 70s talking about it, and he said that his GP at one point, his general practitioner, had said, so how's your sex life? And your man responded, well, it's none of your goddamn business. So even with the medical professional, I suppose part of that is generational, but when it comes to the communication side of things, Dr. Toshima, help us out, because that's a tough one.
Yeah. I can talk probably for an hour on that whole issue, but I think about it in terms of what I call the 5 C's. Okay, so
work away.
Yeah, I'll work away. So number 1 is concerns, and I think when you talk about what's going on. You have to know, what are my concerns around sex? Because if you don't know, if you can't identify what your specific concerns are around sex, how in the world are you going to be able to communicate that with anybody? So I really ask people to think about that first. And many concerns that people have shared with me are things like, will I ever find a partner? Will I find a partner who would find me attractive? I have no experience or confidence with my sexual abilities anymore. I'm concerned about how my body will respond. I'm worried about what a partner might think or feel if they're with me sexually. I'm concerned about bowel and bladder accidents during sex. I mean, will I have energy for sex? So all of those questions and concerns, as a person dealing with these issues, be clear about what your concerns are, because your concerns are going to be unique to you. And if you don't know what they are, you can't communicate that to anybody. So that's number one. Know what your concerns are. Spend a little time thinking about that. And then we come to the piece you talked about, Trevis, which is communication with partners and with providers. You know, I always think it's interesting when I talk to patients, how many times they say that their providers don't ask them about sex or their sexual function, oftentimes. Or if they do, as your 70-year-old patient said, it's none of your goddamn business, right? They don't want to talk about it. So it's about this idea that give yourself permission to talk about sex. If your providers don't bring it up and it's an issue for you, take the lead, bring it up. It's important. Your partners may be reluctant to bring it up because they're operating sometimes with these myths or misconceptions we have around disability and sex, which is partners often think you're not interested or you have more important things to worry about. You know, I don't want to burden you with thinking about sex when I know that you have pain and you have fatigue and you have all these other issues. So again, your partners may be reluctant to bring it up, but both of you are thinking, this is important to me, but neither of you are talking about it. So think about that. And then recognize that either you or your partner may not be ready to talk about sex. That's okay too. Kind of read the room, figure out what the temperature is, and are you ready? And if so, it's okay to start that conversation. And then the other thing that I caution people about communication wise is we are all guilty of doing what I call mind reading or making assumptions. I say, don't ever try and guess what your partner is thinking or feeling. It is so not helpful. Don't guess, have a conversation, find out, right? Be curious. So in order, again, for there to be successful communication around sexual concerns, you need to know yourself, what my concerns are, what it is I want or need, and that may take some time to formulate. And then focus more on what you need as you communicate rather than worrying about what your partner's reaction might be. That's kind of a starting point. And then, of course, the other 3 C's, I'll intersperse them and interject them as we go along.
Okay.
But I think those are important things to remember when it comes to communication. Know what your concerns are, and then give yourself permission to talk about sex.
And I must say, as a former patient, you must have written these C's after talking with me, because this is exactly the kind of things that we talked about, particularly as a single person with MS, thinking those exact same things. There's an old joke that God must be a civil engineer, because who else would put a waste disposal pipeline next to a playground? There can be some, and we alluded to them a bit, embarrassing issues of bladder and bowel function related to MS. They become even more so embarrassing if it comes during foreplay or intercourse, and I suppose even afterglow and cleanup. So, Professor Yang, I'll start with you on this one. Sex is messy. MS can be messy. You put them together and it can be really messy. So when we're talking about MS and the messy parts, bladder, bowel, etc., are there medications that can be used to kind of help control those, or what are there's so much there. So Professor Yang, help us out with the messy parts.
Well, I think you are alluding to control of the bladder and bowel during sexual activity. And what I recommend to people is, if you experience these things, whether you're a man or a woman, the easy thing to do is to evacuate your bowels evacuate your bladder prior to sexual activity. Now, this all requires some planning, but planning makes for a better sexual encounter. Planning when you have enough energy in the day, okay? Everybody likes to think, because when people are younger, this happens to be the fun part of things. Spontaneous sexual activity is the quote best, unquote. However, as people get older or accumulate disabilities, planning to have sex actually makes for a better encounter. So if you do a bowel program, make sure you do your bowel program sometime earlier that day. Empty your bladder immediately before sexual activity, and plan for a time of day that both partners are well energized, optimizing the ability to enjoy the activity and the intimacy.
I think we were on a program or something a number of years ago, and I mentioned that, foreplay can begin with "Good morning, dear," and so planning a time, it can actually add to some excitement toward that, particularly as we grow older. But it also can then allow for the planning of the rest of what happens to be required for sex. But mistakes and accidents can still happen, and I suppose it's a little easier for perhaps a long-term partner, et cetera, than it would be for that casual partner. I know that some of the people that have been in touch with us talking about those levels of embarrassment and the ick factor and all that. But at the end of the day, we just have to, I suppose, all understand that we are human animals, and that sex can be messy, and we're just going to have to get on with it.
Right. As far as urinary incontinence is concerned, or lack of urinary control, it's actually fairly common in women without neurologic disease. So this is not specific to MS, and it's hard to control because there are a number of different situations or conditions that lead to lack of urinary continence. So for any given person, it could be due to any number of things. So it's hard for me to generalize and say, oh, take this medication. And really, I don't really want to introduce more medications into somebody's life without really managing the easier behavioral modifications that could be very helpful. For men who find that they commonly leak urine during sexual activity, wearing a condom can be helpful. So that contains things, and to some extent, and that's another behavioral modification, non-medical, medication-related activity you can try.
And I think that our discussion thus far even is going to be a little surprising to those who are sitting in on this roundtable. And so I appreciate your candor. And again, I hope we're not offending anyone, but I think that we're probably enlightening, and I think it's very refreshing to a lot of our audience. And speaking of the audience, I know that there are a lot of caring partners which will be watching this webcast program as well, and some of those care partners, or some of those partners, I suppose, are caregivers, care partners. Some of them on the most intimate levels, when we're talking about bathing and dressing and toileting and the lot. And so, Dr. Toshima, can you maybe help someone when they're thinking about, how do I compartmentalize my carer time versus my intimate sexual partner time? That's a big one for our care partners.
Absolutely. Really good question. I don't think there's an easy answer, to be honest. It's hard. I mean, some people are just great compartmentalizers from the get-go. They can just like change a hat and they're into a different role. But a lot of people, it's very difficult to do that. The lines are really blurred. So what I encourage people to think about is when you're in more of that caregiver, providing tangible support, practical support for your partner, you know, really to recognize that you are the same person, you're in the same relationship. There really isn't a demarcation between the two. So when you're providing care, let's say whether it's toileting or showering, you know, you're not necessarily in all those moments thinking, well, this is my sexual partner, but it's the same for couples for whom there isn't that caregiving going on. I mean, just the day-to-day cleaning the toilet and you're scrubbing the floor and you're cooking dinner. It's like in those moments, we're not thinking always that, oh, this is my sexual partner. This is someone who's doing, you know, taking the garbage out and cleaning out the, you know, the bathtub ring. It's not all glamorous. So I think, again, you can think about relationships as constantly kind of expanding and contracting and moving. You know, you're doing a dance, and sometimes the dance is intimate and really wonderful, and other times you're like, you know, off on your own, kind of doing your own stuff. So I think that's the way to think about it. It really is a dance of coming together, separating, realizing that, you know, it doesn't diminish the quality and the type of relationship you have. You just have to understand that for all partners, for all relationships, it's not always like, ooh, I'm feeling really sexual. I'm feeling like, oh, this really turns me on. It's not. Scrubbing the toilet is not a turn on for most people. You know, changing the diapers of kids is not a turn on. It's like there are always going to be things that sort of impede or make you feel like, oh, I'm not feeling it. I'm not wanting to be sexual with this person in this moment. And that's okay. I mean, it's absolutely okay to give yourself permission to say, I'm not feeling it right now. I mean, this is, you know, I just had to help you with something that, you know, arguably neither of us really care to have you do. You know, you had to help me evacuate my bowels or whatever. In this moment, I'm not feeling really sexual. So give yourself a little bit of separation. And I think, Trevis, you even said it. Sexual buildup can go on for a day. It can go on for hours. It doesn't have to be in that moment. So give yourself time to build that interest and that arousal back up. If you had to be in that caregiver role, be patient, give yourself time. You know, make the shift slowly over thinking about your partner not as somebody you're caring for, but somebody you care about. And it's not easy. I'm not going to lie about that, but it can be done. Just give yourself patience and realize that that is the normal ebb and flow of most relationships.
I suppose, as I expected it would, our time has far too quickly come to an end. Both of you have answered a lot of very important questions, and I know that there are so many more to be asked. So I would expect that there will be a sequel to this conversation. Until then, however, I want to extend my greatest thanks to both of you, our guests, Professor Claire Yang and Dr. Michelle Toshima. Now, they're 8 hours behind Irish time right now, so I thank you for getting up early to talk about sex and MS. So for all of you who are watching, keep your eyes out on the MS Ireland social media channels for notifications of any upcoming additions to our conversations on the unspeakable bits of living on MS. Until then, I'm Trevis L Gleason, wishing you and your family the best of health, and cheers.